The League of Women Voters of Idaho's 31st Biennial Convention is honored to have as its presenter this evening Mr. Stephen Weeg. Stephen has a 40-year career in health and human services leadership in Idaho. Last July, he retired after 8 years as the Executive Director for Health West, which is a community and migrant health center with 6 clinics in southeast Idaho, serving 9,000 patients per year. Under his leadership, all 6 of its clinics achieved Level 3 patient-centered medical home certification from the National Committee on Quality Assurance. Previously, Stephen was the Executive Director of Telehealth Idaho at the Institute of Rural Health, Idaho State University, owned a health and human service consulting firm, and was the CEO of the State Psychiatric Hospital. He has developed innovative community programs related to behavioral health, child abuse investigation and treatment, services for people with disabilities, and successful interagency community partnerships. He's currently a member of Medicaid Expansion Work Group and the executive leadership team for the Governor's Idaho Healthcare Council, and previously chaired the Governor's Select Committee on Healthcare, which studied and made recommendations to address quality, cost, and access to healthcare in Idaho. A week ago, Thursday, he was appointed by Governor Otter as the interim board chair for the Idaho Health Insurance Exchange. Tonight, Stephen will present Medicaid Expansion, Good for All of Idaho. He will entertain questions afterwards. Please welcome Stephen Weeg.
Thank you, Kathy. So thanks for the opportunity to visit with you tonight about a fairly complicated discussion around Medicaid in Idaho and Medicaid extension and Medicaid redesign. And I first started thinking about talking about it and then realized that this one really needs pictures because it is somewhat complicated about what the impacts are and what we're doing. And I'm available, if you really need to want to ask a question, it's fine for me if you just sort of raise your hand or ask it through the process of this too. So if there's something that you hear that doesn't quite make sense, just let me know. I'll repeat the question so Jim gets it on the video, and then we'll go from there. So I want to talk about who is Idaho's uninsured population. There's a lot of misconceptions about who is uninsured in Idaho and who are the people. A lot of times we hear about folks who are uninsured are basically just waiting around for something to happen to them, living off the dole, living somewhere else. But who are the people? I want to talk about what the current Medicaid plan is in Idaho. A lot of people don't understand what Medicaid pays for and what it doesn't pay for, and who's eligible and who's not. Because Idaho has one of the most Spartan Medicaid programs in the nation. The number of people who are qualified for Medicaid in this state, the programs it has is very, very small, which makes the impact of Medicaid expansion in a state like this very large. Then we'll talk a little bit about the Affordable Care Act and what its impact and what the decisions were made. And then finally what this expansion and redesign would be all about and how that might work. So that's really what we want to talk about, or I'll try to talk about tonight. We have, as best guess from the American Community Survey, which is done by the Census Bureau and does routine checks of folks, about 275,000 people living in this state without health insurance. That's a lot of people. That's about 1 in 6. And you see them every day. Some of the people serving us tonight have no health insurance. It's pretty typical. You stop in a convenience store, don't count on those people having health insurance. You go shopping, don't count on those people having health insurance. It is not common. Of that 275, about 230,000 are people between 18 and 64. About 45,000 children have no health insurance. Some of that are children who would be eligible if the parents applied for Medicaid or children's health insurance. Some are not. Some are children who are not legal residents and therefore not eligible for the Medicaid program. But we have a lot of people in Idaho who have no health insurance. And we'll talk about the impact of that as we go along. Where are they? About, of that 275,000, about over 104,000 are people who live below 100% of the federal poverty level. 100% of the federal poverty level for a family of four is around $20,000. It's not a lot of money. 37,000 live between 100 and 138% of poverty. 87,000 between 139 and 250. The other 35,000 are between 250 and 400. There's no real good statistical data. There's very few people over 400%. Actually, 400% of poverty for a family of four would be about $80,000. Idaho's per capita income is a whole lot lower than that. So we don't have a lot of folks in Idaho. And actually, if you have $80,000, you could afford some amount of health care coverage. But what I tell people is the reality is this. Most of you in this room will understand it. Every one of us at some point in our life will have a health care cost bigger than any one of us can afford unless you're Bill Gates. And that's just the reality. That's who we are, and that's what it is. So how we care for each other is critical. I think for me the fundamental question in all of this is we are the most economically developed country in the world. We are the only economically developed country to this point who does not provide health care, basic health care, for everyone living in this country. Every other economically developed country sees universal care as part of the social contract and good for the health of the country to do that. We haven't. We've been trying to figure it out. The Affordable Care Act is our most recent iteration of how to do that. So we have a lot of folks who don't have health care. That's our starting point in this state. Many states under the Affordable Care Act already had people below 100% of the poverty level covered under their Medicaid programs. Idaho does not. Who's uninsured? Almost over half of the adults who live below the poverty level have no health insurance. Almost half the people who below 200% of the poverty level have no health insurance. Children below 200%, the uninsured rate is 15%. That's because of the Children's Health Insurance Program that exists in Idaho. Actually, Idaho is one of about 10 to 12 states that does not cover kids up to 200% of the federal poverty level. It covers kids up to 185%. So we have one of the lowest levels of eligibility for children's health insurance in the country. But basically, if you're looking at people below 139% of poverty, which would be the people who would be eligible if Medicaid were to expand, we're looking at about 140,000 people. That's a lot of folks who could afford get better health care. The flip of that is where we are as a state. We are the fourth lowest state in the country when it comes to employers offering health insurance. So we are a small employer state, and most of the employers in this state do not offer health insurance. If you look at employers of 50 people or less, which is really very small business because of the cost of care, I think Alaska beats us. Other than Alaska, which is unusual because usually it's Mississippi. But of employers of 50 or less, we have the lowest, at 28%, we have the second lowest rate of employers offering health insurance. So if you're working at a $7, $8, $9 an hour job in a small business in this state, the odds are that you are not going to have any health coverage. That's the status quo. We can talk about whether that's good, bad, or indifferent, but the reality in this state is this. We are a small business state. We have we have some of the lowest per capita income in the country. We have employers who don't offer health insurance, and we have high numbers of people who live every day uninsured. So who are the people who live uninsured? Most work. In most uninsured families, there's someone having a full-time job. Most are adults who have kids, but if you don't have health insurance, you generally have no access to good routine health care. Most then defer care, put off care, end up using the emergency room if needed, may end up going through the state or county medical indigency catastrophic programs. But if you're low income, you're below 100% of the poverty level, and you have to choose between rent, food, gas, a supply for your kids, clothes for your kids, or your own health care, generally speaking, your own health care ends up last on the list. That's just how people have to live. The health behaviors tend to be severe. There's higher rates of obesity. There's higher rates of tobacco use among lower income people without health insurance. Most folks don't seek preventive care. Most of us don't always do good preventive care no matter what, but if you're low income and uninsured, you can't afford a preventive care visit. And if you're feeling okay, you're not going to spend $100 or $150 or $200 on a visit in the labs it's going to take. You just don't do it. There's a high prevalence of chronic health issues, diabetes, hypertension, heart disease, mental illness. I know at the community health center when I was there, diabetes, hypertension, and depression were the three most common diagnoses of people that we served. And we served a low-income population. Almost a fourth of the population experienced a diagnosable mental illness in a 12-month period. Life is pretty stressful when you're living on the edge. And if you don't have health insurance, the reality is simple. You die sooner. You live sicker. When people ask you about your health, you report fair or poor health status as a person. Now, the other thing that I think is important to think about is, if I asked you in this room, how many of you would choose to live below the poverty level? I don't see any hands going up. You know, the reality of that is that people don't choose poverty. And people talk about, well, folks could do things, but I've heard a lot of people talk about wanting to make a better living and have a good living. But I've never seen, well, I have a few old friends from the 60s that probably like living in poverty. But generally speaking, nobody chooses this. And so it's not a matter of, oh boy, I think it's a good idea to live on the edge, to have a car that doesn't start, to have a part-time job, to have to go to the desert industry to get my best clothes, and not sure whether or not I can get a month's worth of the food stamps to stretch out for the food we've got. That most of us don't choose that. So let's talk about what is Medicaid today. And a lot of people get Medicaid and Medicare confused. Medicare is, the good news over 65 is this country does have universal health coverage. It's called Medicare. And it's, if you're over 65, you finally win your way in. And the premiums aren't too bad. And it is universal. And it covers everybody, no matter what. Modeled it after Canada, but it's not a bad thing. So there are about 240,000 people on Medicaid right now. Medicaid is for people below 65 or for some elderly folks over 65 who are very low income, who need help with long-term care. 70% of Medicaid folks are kids. Yes?
So does that include the kids on the CHIP program?
So this 240,000 includes kids on Medicaid and the Children's Health Insurance Program.